Alpha PVP, crystals, salt, flour, is a heavy synthetic drug that has a stimulating effect on the central nervous system. It differs from many drugs in its availability, which determines its distribution, active use. For a drug addict, alpha PVP is a way to quickly achieve euphoria and other desired effects, which is associated with the rapid absorption of the substance into the bloodstream, affecting the nervous system. The so-called salts are toxic agents, therefore, after the first use, they provoke side reactions from all body systems. Alpha PVP is rapidly addictive, and exceeding the maximum single dose is inevitably fatal. Drug addiction is difficult to treat, which is associated with the difficulties of removing the synthetic substance. General information: alpha PVP, alpha pyrrolidinopenchiarphenone, is a recreational psychostimulant of synthetic origin. Belongs to the class of cachons. It is a desmethyl analog of pyrithalerone, a representative of a new class of alpha-pyridinophenones. It has a stimulating effect on the central nervous system by increasing the synthesis and release of dopamine, norepinephrine in the structures of the brain. In slang, it has many other names: flacker, speed, nip, zombie. These names come from the specifics of the action. The psychostimulant is quickly absorbed into the bloodstream, almost instantly has a stimulating effect. And prolonged use depresses the mind, in fact, makes the addict a zombie. The class of Greek letter alpha-pyrrolidinophenones stimulates the central nervous system by selectively inhibiting dopamine and norepinephrine transporters, while the effect on serotonin transport is negligible. Wikipedia: alpha PVP was first synthesized by German scientists. The first illegal cases of psychostimulant use were noted in the United States, Japan, and European countries no more than 10 years ago. The mode of action is similar to other synthetic drugs of the cathinone class. Alpha PVP is produced in white crystals with a high degree of processing. On the market for narcotic products, a psychostimulant of low quality with insufficient purification is sold, so its shade can be pink or dark brown. Some manufacturers add yellow, blue, green, or red food coloring to the crystals to add color. Moreover, such an additive, its volume, does not affect the narcotic effect. When milled, the alpha PVP salt retains its natural white tint inside. If the crystals have a yellow, brownish color during crushing, this indicates possible errors in production or the use of low-quality ingredients. History of creation and distribution: alpha-pyrrolidinopenchiarphenone was created in the 1960s. It was developed by employees of the pharmaceutical company Boehringer Ingelheim, headquartered in Germany. This chemical was originally part of drugs that stimulate the central nervous system. They have been used to treat apathetic depression, pathological drowsiness. About 10 years ago, alpha PVP became widely used for recreational purposes. When illegally produced, it is included in many designer drugs, and is often a component of bath salts. As a recreational psychostimulant, alpha PVP has become popular in the US, Europe, and Japan. Since 2016, the media has been actively spreading information about what flacker makes zombies out of consumers. The reason is the cases of inadequate manifestation of aggression and cannibalism in people who are allegedly under the influence of drugs. However, subsequent laboratory tests have not confirmed this claim. The word flacker comes from the Spanish language. Denotes a colloquial description of a seductive, attractive woman. Other slang names for the drug in the US and Europe are crystal love, gravel, vanilla sky, pure energy. In the CIS countries, alpha PVP is called salt, speed, dog, alpha, crystals. The main drug producers are Chinese underground companies. Their purchase price for 1 kilogram of the substance is about $1,500. Retail price of the same volume in the USA is $50,000. Methods of use: the drug alpha PVP is used in various ways, with the same effect, but the timing of its onset is somewhat different. This is due to the rate of local absorption. So alpha PVP is taken as follows: Rice 1. Methods of using the drug alpha PVP intranasally. Inhalation, instillation or rubbing of crystals into the mucous membranes of the nasal passages of the drug through the nose is considered dangerous. This method of use causes a quick onset of persistent addiction. It can also cause severe burns to the mucous membranes of the upper respiratory tract. For more comfortable inhalation, the so-called flour is made from alpha PVP crystals, that is, the product is crushed as much as possible orally. Taking alpha PVP by mouth through the gastrointestinal tract is the most common, safest method of ingestion. Drug addicts eat or dissolve the drug in drinks. The dosage for oral administration is 5-25 mg per serving. Intravenously, the introduction of the drug into the systemic circulation is carried out by preparing special solutions. This method is dangerous not only with a persistent form of addiction, but also with an overdose, which is often fatal. Intravenous forms of alpha PVP cause severe brain damage and serious mental disorders. Inhalation. The method is similar to using methamphetamine. Smoking alpha PVP gives you a quick, vibrant kick in. The danger of this form in the high probability of combining psychostimulant crystals with other more toxic agents that are used as a supplement have a more severe effect on neuropsychiatric health. How does it work? Stimulant alpha PVP is a strong narcotic drug that has a pronounced effect on the nervous system, causing changes in the mental state and other body systems. The constant influence of a synthetic substance leads to a gradual deterioration of cellular structures, a change in psychological consciousness. Physical symptoms. The physical effect of alpha PVP drug is as follows: increased physical activity. After taking the drug, a person becomes active, perseverance disappears, restless legs, spontaneous physical sensations that are accompanied by uncontrolled movements of the lower extremities, increased tactile sensations, which leads to increased sexual arousal, deterioration or complete disappearance of appetite for the duration of the action of the psychostimulant, a change in visual function, which is manifested by the pathological activity of the eyeballs, a change in color light perception, inhibition of visual acuity, its clouding, increased blood pressure, increased heart rate, an increase in body temperature, increased sweating, diuretic disorders, slight dizziness, muscle spasms, tremors of the limbs. Cognitive changes. The alpha drug PVP leads to a change in consciousness that differs from typical perception, accompanied by an intense process of consciousness. This condition is called a psychedelic trip. Alpha PVP salt. Its trips are manifested, acceleration of thought processes, which are replaced by inhibition, feelings of fun, euphoria that cannot be controlled, increased concentration of attention with focusing on one object, person, a sense of their own superiority, greatness, the appearance of visual effects that appear with both closed and open eyes, multicolored kaleidoscopic patterns, leaves, eyes, feathers, mushrooms and other visual pictures, change in the perception of space or Alice in Wonderland syndrome, violation of the perception of time, its slowing down, oppression of logical thinking, increased imagination, sleep disturbance, worsening falling asleep, insomnia or nightmares, repeated repetition of the same action, the renewal of childhood experiences, the experience of birth or death, transpersonal experiences, characterized by the exit of consciousness outside the physical body, hallucinations, psychosis, confusion of consciousness. The use of alpha PVP can be accompanied by a manic syndrome with increased sexual activity, uncontrolled aggression, resourcefulness, and strength. The psychedelic state with the use of alpha PVP takes on a wavy character. In the middle of the trip, symptoms abruptly subside and then return with renewed vigor. After the experiences, the addict experiences joy, empathy, harmony, and happiness. Less often, opposite feelings of internal disharmony arise. As a rule, much depends on the mental state of the recipient. At the molecular level, these compounds are able to increase the extracellular levels of monoamines in the brain by selectively and potently inhibiting the reuptake of dopamine and norepinephrine, by inhibiting the mechanisms of the dopamine transporter, DAT, and the norepinephrine transporter, NET, respectively. It is believed that the higher DAT inhibition rate, and the negligible analogous value for SMART, serotonin, abyridinophenones, underlies the powerful psychostimulatory effects of this subgroup of synthetic cathinones, and contributes to a high level of addictive potential. Abyridinophenones, mechanism of action, pharmacological activity, metabolism, modes of administration, toxicity. Aracidolin, A.V. Anziborov. Volume 19, Number 3, 2017 Human Medical Journal. How to recognize a drug addict. Alpha crystal has a strong effect on the nervous system, changing the physical and psychological state. Therefore, the use of a psychostimulant cannot go unnoticed. The drug causes severe intoxication. Symptoms of the use of alpha PVP: pale reddish unhealthy skin tone, an increase in body temperature, The limbs of a person who has used a psychostimulant become hot, a sharp refusal to eat, insomnia, excessive physical activity, involuntary grinding of teeth, frequent urge to urinate, dilated pupils, lack of their response to light, excessive joy, which can be accompanied by outbursts of manic aggressiveness or be completely replaced by them, chaotic movements of hands and feet, perspiration on the forehead. Rise basic effects of alpha-PVP. The appearance of these signs indicates drug intoxication. A person needs medical care that will help not only restore consciousness, but also promptly prevent complications associated with the use of alpha-PVP. Metabolism, the rate of absorption into the systemic circulation, and the effect depends on the method of administration. The immediate effect occurs when administered intravenously. When inhaled through the nasal passages, absorption into the bloodstream occurs within a few seconds. When taken orally, the absorption rate is the smallest. The effect of the drug alpha-PVP can be seen after 15-20 minutes. The psychostimulant reaches its peak concentration 90 minutes after it enters the systemic circulation. The maximum effect lasts for 30-45 minutes. Alpha-PVP lasts up to 8 hours. The gradual decline in psychedelic symptoms occurs within 4 hours. After being consumed in various ways, alpha-PVP breaks down in the body into two metabolites: 1-phenyl-T, pyrrolidine 1-ol, penton 1-ol, alpha-2-oxopyrrolidine-O, valerophenone. Decay products are excreted by the kidneys, therefore, after consumption, they are found in the urine. The half-life of alpha-pyrrolidine and penchiophenone is 12 hours. Complete evacuation from blood and urine occurs within 3 to 6 days. With prolonged use, drug residues can be found in the hair for up to 90 days. How to speed up elimination? Outputting alpha-PVP is faster. The procedure is carried out in an oncological hospital. For this purpose, the drug addict is assigned droppers with sodium chloride and glucose solutions, which help cleanse the blood, alleviate the general condition. Diuretics for force and diuresis, intramuscular or intravenous administration of vitamin and mineral complexes, especially group B, immunomodulators to increase the body's resistance. You can force the elimination of alpha-PVP at home. To this end, doctors recommend drink plenty of water, more than 3.5 liters per day. Take a diuretic for the accelerated evacuation of metabolites. Drink sorbents to cleanse the digestive tract with oral intake of alpha-PVP. Enrich the diet with vegetables, fruits, dairy products, herbs, which will strengthen the immune system, speed up metabolic processes. Exclude coffee, alcoholic beverages from the diet, which retain water, toxins in the body, interfere with the normal cleansing of the body. At physical activity, sports can speed up metabolism, remove toxins. Visit a bathhouse or sauna after the restoration of the psychophysical state. Increased sweating helps to cleanse the blood of toxins and toxins. Is it addictive? Alpha-PVP in crystals forms psychological and physical dependence after the first application. This is due to the formation of withdrawal symptoms in the process of cleansing the body of metabolites. Alpha-PVP remains in the body at its maximum concentration for 3-6 hours, and complete elimination occurs within several days. Therefore, after a decrease in the level of the drug in the systemic circulation, withdrawal symptoms develop. Breaking causes a lot of discomfort, so it often forces you to take the dosage of the drug again. The psychological form of addiction develops as a result of the neurotoxic effect of the substance on the body. It is formed after the first drug use. It manifests itself as an aggressive state, loss of self-control, deterioration of the psycho-emotional state, sleep disorders. The physical form of alpha-PVP dependence occurs after psychological addiction and is associated with a change in physical condition, accompanied by the following signs: increased anxiety, aggressiveness, change in appetite, disorder of the digestive tract with nausea, vomiting, general weakness, chills, limb tremor, violation of coordination of movements, orientation in space, headaches, dizziness, increased sweating, pallor of the skin. The emergence of these symptoms, together with constant thoughts about the drug, its effect pushed the person to reuse. A persistent addiction from the psychoactive substance is formed. Therefore, it is quite difficult to throw alpha-PVP on your own. You need the help of specialists. Side effects: alpha-PVP causes side effects after the first dose. Some of them can be fatal. Death from alpha-PVP occurs as a result of an overdose or inhibition of vital functions by metabolites. Side effects include psychotic behavior, delirium, hallucinations, clouding of consciousness, loss of the ability to have pleasure without drugs, anorexia, panic attacks with tactile, visual, auditory hallucinations, hypertension, tachycardia, arrhythmia, myocarditis, myocardial infarction, damage to the neuromuscular system, renal failure, regular headaches, convulsions, memory loss, swelling of the brain, acute violation of cerebral circulation. RICE-3. Side effects of alpha-PVP overdose. Alpha-PVP poisoning occurs when the maximum single dosage is exceeded. When inhaled through the nasal passages, it is 25 milligrams of crystals. When taken orally, 14 milligrams. Alpha-PVP overdose is accompanied by the following symptoms: hallucinations, panic attack, clouding of consciousness, a sharp rise in body temperature to critical levels, pallor and cyanosis of the skin, convulsive syndrome, trembling limbs, a sharp jump in blood pressure, interruptions in the work of the heart muscle, lack of response to external stimuli, nausea, vomiting, convulsions. Consequences of use. The effects of alpha-PVP can be seen after just a few doses of the crystalline drug. This is due to a strong destructive effect on the cellular structures of internal organs. Drug use can cause the following complications: gradual destruction of brain cells, which leads to a decrease in intelligence, memory impairment, a decrease in the elasticity of the vascular walls, a violation of blood clotting, blockage of the lumens with blood clots and cholesterol plaques causes heart attacks and strokes, destruction of muscle fibers of internal organs, renal and hepatic failure in violation of their functions, as a result of prolonged accumulation of metabolites and toxins of alpha-PVP in the organs, increased risk of infection with hematologically transmitted diseases, herpes, HIV, syphilis, deep form paranoia, loss of vision, severe mental disorders, death. Drug intoxication from alpha-PVP often occurs with undesirable effects, hallucinations, delusions, suicidal tendencies, panic, and paranoia. Lethal dosage. The use of the drug, a decrease in the severity of its effects, are forced to gradually increase the single dosage. Sometimes the addict stops controlling the dosage of the psychostimulant and can take a lethal amount of the substance. The lethal dose of alpha-PVP is individual for each person, depending on body weight of the drug addict, the general state of human health, experience of use, the speed of metabolic processes, time of the last use of crystals, the method of introducing a psychostimulant into the body, combinations of drugs with other drugs, alcohol, drugs. Fatal overdose can occur with a single use of the following dosages: intranasally, more than 100 milligrams, orally, more than 120-150 mg, intravenously, more than 50 milligrams, inhalation, more than 20 milligrams. Overdose symptoms always come on quickly. Lack of medical intervention causes cerebral edema, stroke, respiratory arrest or cardiac muscle function. A dangerous combination. The psychostimulant has a pronounced toxic effect on humans. The harm of alpha-PVP increases when combined with other narcotic and psychoactive substances, which also negatively affect the functions of internal organs, the general mental state. Such combinations can also be fatal. A combination of alpha-PVP with other stimulants of the central nervous system, since they increase the frequency of contractions of the heart muscle, increase blood pressure at critical levels. This can cause heart failure or cardiac arrest. Antidepressants, in particular with selective serotonin reuptake inhibitors and monoamine oxidase inhibitors. This combination causes serotonin syndrome, which is characterized by a change in the mental state, dysfunctions of the autonomic system, and neuromuscular dysfunctions. Methoxetamine and dextromethorphan, as it can cause an increase in heart rate, an increase in blood pressure at critical levels. On the part of the mental state, drugs provoke panic attacks. Tramadol, which increases the side effects of alpha-PVP such as tremors of the limbs, excessive sweating, and convulsive syndrome. MDMA, which enhances the negative effect of the psychostimulant on the body. Cocaine, as it increases the load on the heart muscle, the vascular system, leads to their rapid wear, increases the likelihood of heart attack, stroke, heart and brain. Alcohol, since the multidirectional effect on the nervous system changes its functions, leads to the rapid death of cells. The combination can cause severe intoxication with a fatal outcome. Help with poisoning. When the first symptoms of alpha-PVP poisoning appear, it is necessary to urgently provide the victim with first aid. This will not only save life, but also prevent serious complications from the cardiovascular and nervous systems. If symptoms of intoxication are detected, an ambulance should be called, after which, to provide an influx of fresh air. To do this, unbutton your clothes, open a window, cleanse the stomach by drinking plenty of fluids, vomiting only if the victim is conscious, drink sorbents to bind metabolites, toxins, accelerate their evacuation, take Pregabalin, Noshku, Papaverine for relief of physical withdrawal symptoms, vasodilation, ensuring normal blood flow, lay the patient on a flat surface, turn his head to one side if the victim is unconscious, which will help prevent tongue retraction and clogging of the airways with vomit. If, before the arrival of doctors, the victim has stopped breathing, it is necessary to do artificial respiration. And in case of cardiac arrest, an indirect muscle massage. Treatment alpha-PVP dependence therapy is only available in a hospital setting. This is due to a pronounced destructive effect on the psychological and physical health of a person. Drug addiction treatment is carried out in 3 stages: relief of withdrawal symptoms, psychological assistance in getting rid of addiction, social recovery after alpha-PVP. Rice 1. Reasons for complicated elimination of alpha-PVP from the body. Relief of withdrawal symptoms at the first stage of rehabilitation. The main task of doctors is to remove alpha-PVP from the body. This will help eliminate the negative effects of taking a psychostimulant, set the person up for recovery and life without drugs. To do this, detoxification is carried out in the inpatients of drug treatment clinics in the following ways: forcing diuresis for the accelerated excretion of drug metabolites with the help of diuretics, blood purification, relief of the general condition by intravenous administration of a solution of sodium chloride, glucose, B vitamins, cleansing the gastrointestinal tract using a course of sorbents. Along with cleansing the body, withdrawal increases. To relieve physical and psychological symptoms, tranquilizers, antipsychotics, antidepressants, sedatives, vitamins are used. Use of opioid antagonists is possible. In some drug treatment clinics, methods of hardware purification of blood from alpha-PVP metabolites are used, which is associated with the difficulties in evacuating synthetic drugs from the body. To normalize sleep, relieve pain, use a mixture of xenon and oxygen, electrolep. Psychological help after stopping the withdrawal syndrome. Doctors begin to treat addictive behavior, which allows you to get rid of pathological cravings and prevent relapses. Cognitive behavioral therapy is considered one of the most effective and recognized methods. The technique is aimed at human thinking and behavior. Cognitive behavioral therapy allows the addict to become aware of situations that provoke the use of a psychostimulant to overcome difficulties without abusing alpha-PVP. This approach stimulates activity, reveals, changes beliefs, teaches self-control, helps to change attitudes towards oneself, loved ones, the environment, and the future. The specialist uses psychoanalysis, which allows you to determine the characteristics of the behavior of a drug addict, his perception, fears. It helps to eliminate resistance on the path to recovery, including subconscious ones, to cope with stress, depression, and other psycho-emotional disorders. Hypnosis is an additional method of treating an addictive state. It provides for the introduction by the psychotherapist of the patient into a state of trance, during which the mindset is introduced into the subconscious mind to refuse the drug and recover. Social adaptation. This is the last stage in the treatment of pathological drug cravings. Allows you to consolidate the results achieved earlier, as well as prevent disruptions in the future, learn self-control, return to a drug-free life. At the post-rehabilitation stage, the support of relatives and friends is important. Their task is to help the former drug addict find ways to enjoy life in a natural way, in every possible way to encourage him in any constructive endeavors. They can be hobbies, literature, any kind of sports. Conclusions. Salt alpha-PVP is a white crystal that is consumed by smoking, nasal inhalation, oral or intravenous administration. It has a pronounced stimulating effect on the central and peripheral nervous system. Already after the first use, it provokes a withdrawal syndrome, which leads to the formation of addiction. Addictive behavior, the desire to constantly enhance the effects of a psychostimulant, leads to a gradual increase in dosage. This becomes the cause in the death of the drug addict. You can remove alpha-PVP from the body at home by changing your lifestyle, restoring normal metabolism. However, it is difficult to cope with the pathological craving for drugs on your own. Qualified medical assistance is required in the conditions of an oncological clinic.